Yeah, to introduce myself, I would say that I am a Cameroonian. I am trained in Cameroon and I did most of my education in Cameroon. And I am trained, first of all, as a chemist, and then I got a PhD in physics. And after that, I went abroad into Germany, specifically where I did my habilitation in pharmaceutical chemistry. So, in essence, what I would say principally is that I'm a qualified professor in pharmaceutical chemistry. And I'm mostly doing my work in the area of drug discovery. So I'm a Cameroonian. I am still approaching 50. I'm a father. I'm a husband, and I'm a Christian. I love God. I love people, and that's about NTIE-KANG Fidèle. Yeah, as a head of a laboratory, my job is principally to define the research projects that take place in my lab. And I also supervise students. I supervise master's students. I supervise PhD students. And I also train students even beyond those whom I supervise. That means I teach courses. And when I teach courses at the university, I basically do both the theoretical part of the course and the practical part of the course. So I receive students in my lab to train them in hands, to give them hands-on skills so that they can better appreciate some of the things I teach them in class. So that's my job as head of lab. Apart from that, I have to write projects for funding. So in essence, for the lab to run, for me to buy the supplies like the chemicals, like the computers and like the equipment that we use, I need to get money. So in essence, writing grants and defending them, going to conferences and giving talks is part of my work as well. Yeah, talking about the position as a senior researcher at the Martin Luther University, that was basically a position that I was occupying while I was doing my habilitation. So what you do basically is that you have to teach students. So I was teaching master students mainly. So and then when I teach them, I have to bring them to the lab to do supervise them while they're working. I have to evaluate their projects. I have to set exams which I'll mark. Of course, I have to do research as well. So my activities were between teaching and research. And during this time, I had to evaluate the students. They also had to evaluate me. So it's part of the normal process of doing habilitation. And then, of course, when there's a student is presenting the progress of their work, I also make remarks. I also evaluate students. For example, when students are preparing for PhD, I can receive reports to evaluate the thesis, if the thesis is good enough for a PhD or for something like. Right now, I can actually evaluate even those who are applying for habilitation. What I would say is the basic problem, or there are many, concerning the manufacturing or the production of natural herbal medicines in Cameroon. There are many. The first of them is personnel. I don't know if there are many Cameroonians who are sufficiently skilled to be able to work in a pharmaceutical company or to be able to at least be involved in procedures that will lead to the manufacturing of, I would say, enhanced traditional medication, because you have to be properly trained to do this. Because in our universities in Cameroon, do not have curricula that are tailored to meet the needs of the pharmaceutical company. That's the first thing. And so it's right now that a couple of courses are coming up in pharmacy and medicinal chemistry, but which are still at the very start. The second thing I would say also is the infrastructure, the basic infrastructure to be able to make medications. We all know of Ron Pullen in Douala, but this was a company that existed many years ago that was designed to make generic drugs. So, like talking about pharmaceutical industry in Cameroon is almost inexistent because we basically have to start everything from scratch. So, that's a basic problem. The third thing I would see, which can be is a serious issue, is standardization. That the protocols to be used for making traditional medicines or medications as a whole that human beings have to consume have to go through a standardization process. But right now, it looks like everybody just does their own thing, and there is no control, no quality control, and standardization as to making sure that what goes to the market is safe, is efficacious, and so on. So a medication must first of all be safe. That means that when people consume it, they don't get sick because of the medication. It should be efficacious in the sense that it treats them when they get sick. And of course, the dosage has to be well defined. So all these are mostly absent, and this is a serious issue. Yeah, the University of Boya Center for Drug Discovery at the moment is not drug development and drug production. These are two different things. Drug discovery, which we are doing, is the very early stage of drug discovery. That means what we call preclinical drug discovery. So our work mostly involves studying drug targets, understanding the interaction between drugs and their targets, beginning from a computer and taking it to in vitro laboratory. That means work that is carried out in a test tube, and then from there, if the compounds seem to be interesting, or they are carry out the function we expect from them, that's when we can now take it to small animals. So again, we have not yet even reached the level of small animals. So we are right now, we are at the very early stage of drug discovery. But our goal at the end will be eventually to have a development unit, a drug development unit, and a production unit. That means at the end, when we have a very interesting or a compound, then this compound, after having tried the test in the animal models and so on, we can now suggest that this should be carried out, that this should be tested in clinical trials. And then it's when the compounds have shown that they are efficacious and safe in clinical trials, that's when and only when we can now talk about production of the drugs and all that. So we are really at the very start, at the very scratch of drug discovery. So we cannot say that we are going to solve all the problems that are in the market today, but we can provide expert advice through conferences and so on, through training. And our goal is to eventually to start up a training program in University of Boya, Masters in Drug Discovery, so that those who are trained, we can now further find possibilities of giving them placements in pharmaceutical companies abroad, and if that can be possible, so that they can be able to bring back the skills that they need in order to develop the pharmaceutical industry in Cameroon. So this is the long-term goal we have. Certainly, as an award winner, I'm very happy at the personal level that, first of all, we are able to have this recognition, which is an international recognition. And the country is also proud because I would say there was only one award in the whole of Central African region, and it was given to Boya University and given to my humble person. So I would say that I'm very happy, first of all. And the second thing I would say is that the funds do not permitted us also to construct an edifice, a building, which permits us now to train students, which means that it more or less makes me to live out the goal of my life that I had from time as a young person. Because as a young person, I always dreamt of bringing out the best out of young people. I have always been a teacher from the time I was small. And I think the Center for Drug Discovery simply creates a platform that permits me to, as a person, to exercise that which I dream to do, and also permits young Cameroonians to study under better conditions than what they used to study before, because we try to put state-of-the-art equipment, state-of-the-art environment for training, so that at the end of the studies, when our students leave from Cameroon, our goal is that if our students leave from here and go abroad, they will not find the atmosphere over there quite different from what they had back home. That's the thing. And so this for me is more like a dream come true. And of course, this platform is not only the end of the road, because the drug discovery center that we are setting up is like a platform that will necessarily have to attract other funding. So in essence, right now we are talking about many other applications that we think we should put in the pipeline and expect to get funding that would continue to develop that which we have started doing. So the center is not the end of the road. There are many projects that we have in mind, which we use the center as that platform to do this. Yeah, there's something I would say about the pandemic. The pandemic is just one disease out of many. So drug discovery should not target just one disease, because very often disease conditions are complex. That means that one disease coupled with another can lead to more complex situations than what we imagine. For example, if someone is suffering from TB and also at the same time has HIV, that can be really complicated, because we are talking about the immune system not responding at the same time you are giving medication to combat a pathogen. So you have a situation like that, and then now we have several studies which have been published recently, not from my team exactly, that shows complications that come as a result of SARS-CoV infection with HIV and tuberculosis. So imagine such a situation. So in essence, what we are saying is that the Africa has a very enormous resource, and the resource Africa has is the medicinal plants. We have several thousands and thousands of medicinal plants which have been investigated, and others which we cannot number, which have not been investigated. So my group has been involved in the past to, and we're still doing it till now, to catalog all the medicinal plants in Africa that have been investigated, for which compounds have been identified, for which have some known biological activity, for which the extract or the compound have been tested, and so on and so forth. So we have a lot of data, which of course we have put available to the public, so that this is a big repository for drug development, potential drug development in Africa as a whole. So in essence, our work was at the very start, like digitalization of all this information, which you have now in the web. So in essence, you can know exactly where the plant, what the names of the plants are, how to describe the plants, where the plants can be harvested, and so where samples of plants have been stored. So we have a lot of data like this, and so scientists who are interested in medicine, in doing drug discovery for medicinal plants in Africa, will certainly find our work very interesting, and as use it as a starting point. Like, first of all, to get the baseline information, like which are the medicinal plants used to treat what kind of diseases, and what are the compounds found in them, and what are the activities of these compounds, and so on. So this can be the very start of a drug discovery project. So as I said, it's not just about SARS-CoV or the pandemic. We are more or less, the pipeline we have set is more or less preparing us for any eventual pandemic. So that if there's a disease outbreak, we are not only having electronic data we are collecting right now, we are also collecting samples of compounds which will eventually be tested in any assay if there is a disease outbreak at any time. So this is the reason for having a center for drug discovery. So in 2023 is our desire to be able to have the first set of compounds that have activities against the SARS-CoV virus in the nanomolar range. Right now we have micromolar range inhibitors. So our intention is to have nanomolar range compounds, compound inhibitors that we think can be tested already in animal models. So we have several smart and hardworking students working in the lab, and we have some good collaborations already. Some of the compounds are already being tested, and it's our desire that by the end of 2023 we should have our screening facility ourselves in UB, because now all these tests are being done abroad. And for your team, Ivan's team, and the rest of you, I'm wishing you a happy 2023, and my desire is that God will give you more strength and more determination to carry on the vision that you have started, and that you should not give up. Thank you.